Congressman, good morning. Thanks so much for being here. So why do you believe why do you want to dismantle the coronavirus task force? Why is it no longer needed?
Well, I'm looking at something that you just played, that clip you just played from Dr. Fauci, and I think it's a perfect example of the congeries of inconsistencies and contradictions that have come out from Dr. Fauci. He's become the face of that task force, and he opines on things that he has no evidence or data for. He's been inconsistent throughout this thing.
Can you give some examples of that, Congressman?
You bet. In January, he said, we're not going to have to worry about this. Then he said, you don't need to wear masks. Then he said, well, you know what, if you're healthy, you don't wear a mask. If you're sick, wear a mask. Then he said, you know what, wearing a mask is merely a symbol. Now he's saying, let's wear a mask all the time. An example of something that he's opining on that has no data or science behind it. He says, look, we're not going to be playing baseball in 3 or 4 months. He has no data to support that. He's just throwing something out there. And what he just said, the clip you just said.
If I could stop you there, I mean, even the president has talked about how highly respected Dr. Fauci is as a doctor, as a medical expert. And doctors we have every day on this program, Fox News contributors, talk about how highly respected he is. So are you discounting him altogether?
No, I think his time has come and gone. I mean, look what he's done. What he just said to you is completely contradictory to what he said 2 or 3 months ago when he said we're going to flatten the curve and we got to get out of this. What he just said to you is that the case fatality rate does not even matter anymore. What he's talking about is other issues, and what he specifically said in an early part of that statement yesterday was that he's looking solely at the number of new cases detected. That's what he's relying on. And when you begin to look at that, is that really the number? Fauci has also said that he doesn't care and hasn't looked at what are the other medical or public health issues going on or the economic issues going on. I think that is irresponsible.
And that's to your point, at the multiple hearings that he has had, he's been pressed on that by Rand Paul and others. And his job is to look as an infectious disease expert at the coronavirus and stopping the spread of that disease and learning more about it. But I want to put up on the screen the number of cases in your state, because you are now looking at a record, the highest number of newly reported coronavirus deaths. That was reported as of Tuesday. You're emerging as a new hotspot. One of your local publications in your state is basically calling you out, Congressman, for saying that you want to do away with Dr. Fauci and Dr. Birx and the coronavirus task force because you believe they're making the president look bad. How do you respond to that?
Well, that's not why I want to get rid of the task force, Fauci or Birx. But I think we need to look at those numbers that you just put up. We have 105,000 cases. That's not active cases, Sandra. And the highest number we had was not what was reported yesterday. The highest number we've ever had was 2 weeks ago, and that was 4,400 cases. We started looking at where these cases are coming, they're from the age 20 to 44 bracket. When we started looking at hospitalizations, we're down over 100% over the last 30 days. We look at the case fatality rate, we're down over 100% over the last 30 days, including the numbers yesterday. The numbers yesterday were not the number of people who passed yesterday due to COVID. Those are reported deaths. It's the date of report, not the date of the passing. So we are down on those numbers, on those case rates. If you look at the hotspots in Arizona, they're coming from 4 counties, 2 in the border, 2 in the northeast part of the state on the Navajo Nation. So there's so much context that needs to be put here. And when I say that they make Trump look bad, I'm not talking about making Trump look bad. I'm saying they engender hysteria and panic instead of taking these numbers, and we can't do it because we have a short window here. But don't we have a duty as Americans to follow the guidance of doctors and the science and the study of this disease that we still don't know so much about? And as a member of Congress, to discount the medical advice of these doctors, isn't that a major risk? I'm not discounting the advice of medical doctors. I talk to doctors on a regular basis. I talk to doctors who are treating patients, who are treating COVID cases. I'm talking to people who make public health policy decisions. I'm talking to epidemiologists as well. If you're relying solely on Fauci and Birx, that is a problem, because they're not taking into account the granular data that's available in states like Arizona. They're taking a broad swath and they're applying it to the entire nation. And what I'm saying is there is there's data, there is science to support exactly what I'm saying. I talk to doctors who say the very same thing. We don't have time to necessarily get into it because it goes into granular things, but you have to realize that Dr. Fauci and Dr. Birx, they're looking at it from a general point of view, And I'm talking to doctors who are in this state dealing with this issue on a regular basis.
All right, we have to leave it there. We're out of time. I would love if you would come back and we'll continue this conversation. That task force, by the way, is going to be giving us an update just under 2 hours from now. Congressman, our best to you and your state as we continue to deal with this. Appreciate your time this morning. Thank you.